My name's Sue Tyler and I come from Headway West Midlands. I've been asked to talk today around the changes that are being led by local government concerned with the transformation of health and social care. Basically, already it's had quite an impact on us at Headway West Midlands and in Birmingham. And Rachel asked me to sort of share the kind of things that we've been going through really and some of the things that are happening in the hope that I might be able to impart some of the knowledge and some of the information on yourselves. We're by no means experts in this, you know, far from it. We're still sort of struggling through everything and trying to conform and adapt to all the changes. So hopefully throughout this sort of workshop you can ask me questions or fire things at me. If you've got more information on something than I have, then great, you know, let me know and we can share that information. There's quite a lot to get through, so I'll try and sort of whiz through it quite quickly, but do stop me and ask questions along the way. And obviously another big part of this is we've been part of 13 projects across the country as far as the individual budgets as well. And that's another area that sort of is something we're going to have to look at with a view to actually starting it in October, we've been told now in Birmingham, so it's all coming a lot quicker than we actually initially anticipated. So I thought I'd start by just looking at where this has all come from really. I'm sure we're all aware of putting people first. Obviously it's a vision whereby the government want to put the person at the centre basically. We're looking at giving people choices, giving them basically a better quality of life and access to the support and the services that they actually need. This will mean that people will be able to live their lives more confidently, they'll be able to have a higher quality service and be able to promote their individual needs. This is expected that by 2010, 2011, there'll be significant changes made towards this and that they'll be able to reshape and redesign a lot of the services that are being delivered. And I think we're probably all at different stages, we've all come across different changes that are being made, and I think that's the big thing about this, is it does impact on us all differently and in different ways, and I think it's just sort of hopefully to give us an idea of the type of things that we need to be looking at and where we might be going and how it might be driven. A lot of the local authorities have set up teams and programmes and running agendas for looking at these transformations. And you'll see this come under lots of different titles and different groups, again in different areas. Basically, the main things that are coming out of these reviews, is the modernisation, the transformation, the remodelling of day services, and getting ready for the change in actually how social care services will be funded in the future. And all of us with a Headway house, obviously this is the biggest area really that's going to be affected, and the individual budgets. From just a selection of some of these day service scrutiny reviews, already you'll see that things are starting to emerge that have a similar theme. I've put an example of a few there that I've read up on already. They're saying things like many organisations have had services commissioned for years that they've been lost in the system. So they've been paid by a grant that they've had for the last 30 years, and what's coming back is that most of the time people don't know even who's had the grant. They're just historically paid all the time. They don't know what they're getting for the grant. And this is something that certainly came up in Birmingham, and I know there's a lot of small day services that have lost their funds because of this, that they're just not prepared to fund them anymore. So certainly Headways with the grant funding need to think about that. It might not be something that they're going to be able to continue to get for the future. Many buildings are saying... Yeah?
That's a very relevant point. I'm in Headway, North Derbyshire. All the funding is from PCT. There's no knowledge as to where the funding came from originally. They reviewed it last year as part of a big review package. Still nothing's happened. It's just disappeared back into the system, even though... And they talk about service level agreements, but we don't even know what the original agreement was. Yeah, and it's got lost again, so I know that's healthcare rather than social care, but That's a big issue.
Yeah, it is a big issue. And that's the trouble, isn't it? There probably was service level agreements and things drawn up many years ago, but no one knows what they're about, where they are even, or who actually holds them. I know that's right. And in Birmingham, they've actually, what they did was they just stopped all of those and brought out a new bidding system. And every organisation, and again, this is under health and social care, but had to resubmit a bid. And a lot of them just didn't get funding for day services anymore under that remit. So it is a big issue. Many day services are not meeting the needs of individuals. They're not giving them choices. And the buildings as well are not suitable. You know, they've not got good disabled access and things like that. I think with Headways, we're not too bad on that generally. I think, you know, a lot of Headway houses and that have good access. In many cases, there's no proper monitoring and people are not moving on. It's this moving on thing again, isn't it? Frightens me to death, this moving on. I'll look at that a little bit more later on as well. But again, I think, you know, in terms of moving on, it's what do they mean by moving on is the big issue, isn't it? How do we define moving on? Because I know certainly to us, moving on isn't just necessarily exiting the service. There's lots of other ways that we sort of measure moving on, and that, again, is another big issue. The transport to get people into centres highlighted many issues. For us, it's a big issue because we tend to rely on taxis, and quite often they'll get the funding for placements. But then when you want the taxis on top, it's like, forget it. So it's a big issue for us. I know for social services day centres, they have fleets of minibuses that sit outside doing nothing all day. I think they do a pick-up that's about 2.5 hours. They get into the centre, they're probably there for, what, an hour and a half, 2 hours at the most, and then they're back on the bus, do another big 2-hour journey. So I know that's something certainly in Birmingham that they've been looking at stopping altogether and just getting rid of all the buses. The organisations offering services are not particularly the best provider, and again this goes back to just giving out a service level agreement for years and not really even knowing what they're providing even. Many day services are not cost effective and they are under attended, and again certainly this with local authority ones, they're just paying the money and most of the time they're half full. People from black and minority ethnic communities and people with high needs again are considered as an add-on. They're not considered within the service and part of the service. And day services work in isolation, and again we see where that happens. So just to start thinking really, do any of these apply to us already? You can see straight away that we all probably fit in one or two of those somewhere. So what are they actually changing then to address these issues? They want there to be increased choices for service users. And again, this is one, when we started to look at this, we thought, oh, we do that. But then when we look deeper, well, do we? You know, we might say, well, we've got this day and we've got this day and we've got this on this day. But are we actually going, well, this is what you need. When are we able to provide this to meet that need? And quite often, I think, you know, I know we're guilty of it in the past. We say, oh, well, we've only got that day available. So we'll slot them in, and it might not necessarily be that the things they really need or they really want are always available on that day. You know, so I know it's something we've been guilty of.
Sue, just as another example of that, we get quite a lot of people, we're based in Cambridge, we get quite a lot of people from Peterborough, and we get a phone call every couple of weeks to say there's funding being given for this person who we didn't even know who they are.
Yeah.
They're coming on a Tuesday because we've got space in the taxi.
Yeah.
So, you know, if I've got an individual need,
yeah, it doesn't matter.
It's just, you know, there's space on transport.
That's right, that's right. You know, and this is where I think both us and the local authorities have got to be clear. If they're going to follow this, then we have to say, well, you know, we've got to start from the person. It's got to come from both sides, hasn't it, at the end of the day. Easy access, just that there's a clear process to getting into the service and that it's quick and that people are interviewed quick, etc. The remodelling of daycare care services, providing an affordable for all service. And again, that's a